A top official at the GAVI-The Vaccine Alliance that runs Covax says that providing a third booster shot to populations is unacceptable when so many countries are struggling to access and administer a first dose. In conversation with the SABC's Sherwin Bryce-Pease, GAVI's Managing Director for Country Programmes Thabani Maphosa confirmed that Covax would be expanding its vaccine supply to lower-income countries in the next 6 months, and after under-delivering at just 190 million doses to 138 participating countries or territories since deliveries began in late February. Now, those numbers will have fallen well below expectations, with Africa seeing less than 2% of its population vaccinated, whilst lower-income countries account for 1.1% of those who've received their first jab globally.
Thabani Maphosa, welcome back to SABC News. Good to see you.
Thank you.
190 million doses shipped through Covax to 138 participants/countries as of this week. In the USA alone, 352 million doses administered. China, 1.78 billion doses. The DRC, 86,000 doses delivered, or less than 0.1% of the population. A Reuters headline on Covax in June read as follows: let down by the rich and failing the poor. Is that a fair assessment of Covax to date, in your view?
Well, it is fair to say that Covax has reached so many countries to date, but at the same time, it has not gone as far as it would have hoped to have done at this particular point. So I would say that on balance, we are getting some doses out there, but not as much as we would have liked to see at this particular point.
But specifically, Reuters is saying you're letting down the rich, you're being let down by the rich and failing the poor. Is that a fair assessment?
I think it's a little sophisticated than that, because who is the rich that we are talking about? Covax as a facility has been able to raise $10 billion, which is needed towards delivering vaccines in low and middle income countries. And so I think that as far as the rich playing their part, if we were to adopt that language, they have given resources that are needed. But we still continue to operate in a supply-constrained environment. And of course, there is a disproportionate amount of vaccines that are going to some of the wealthier countries than the developing world. And that needs to be balanced. And COVAX was set up for equity, and that's what we continue to fight for.
Thabani, we've long now talked about this notion of vaccine nationalism or vaccine apartheid between the world's richest and poorest, but the gaps are not necessarily narrowing over time as narratives now quickly shift to the notion of a third booster shot as immunity for some fully vaccinated begins to wane. What dangers does a third booster shot present for what Covax is seeking to achieve?
Thank you. I think you have framed it very well. The third booster makes sense when everybody has been lifted to the same level. But before then, it is simply widening the gap. And it is simply unacceptable that we will see other countries moving to a third dose before other countries are able to actually even get a single dose, for the first round of the vaccines. And so it would be unfortunate to see a direction that moves towards a third dose without bringing others along. And the risk that really sits with that is that we will continue to be in this secular situation where variants are catching up on us and we are not making any progress at all.
The World Health Organization called for a moratorium on boosters until at least the end of September, while we have heard calls for richer countries, including from GAVI and Covax, to donate more of their surplus doses through Covax. Are we seeing an increase in the number of doses that are coming from richer countries, particularly from their surplus supplies, Thabani?
We are seeing an increased number of doses coming through. I think the month of July saw 12 million. We will be seeing more. The US government has donated up to 80 million. The UK government is coming up with more. But France was one of the early movers in that regard. We have seen Sweden. We saw just recently Japan coming through as well. So a number of countries are coming through with dose donation, and we think that it is alleviating the problem, but it is not enough for what we need. So we are grateful for that, but we don't believe it is enough. For the challenge that is before us.
Yeah, we're going to unpack that a little bit further. GAVI CEO Seth Berkley writing this week that Covax is on track to deliver around 2 billion doses to lower income countries by February 2022, which should be enough, you say, to protect at least 30% of their populations. That's 1.8 billion doses expected in the next 6 months, as opposed to the 190 million doses delivered by Covax since February this year. What's driving the improvement you're expecting to see in deliveries?
Well, I think Covax has been working very hard behind the scenes to expand this portfolio. And the number of vaccines that are within Covax have increased, and the manufacturing capacity is beginning to improve over time. We have seen J&J beginning to deliver significantly in Africa lately, but we also have signed a number of agreements that will supplement that. And so it's just the number of vaccines that Covax has, and the deals that are on the way that we have locked in, that we are hoping will actually fill that.
But you agree, right, that 30% of populations is clearly not enough. The WHO in June said 11 billion doses were required to vaccinate 70% of the world's populations. Africa remains at under 2% vaccinated, while GAVI says just 1.1% of people in lower income countries have received their first jab. What do numbers like that tell us about where we are in this pandemic?
Those numbers simply serve to magnify the inequities that exist in our world, but they also point to the work that is ahead of us, that the work is going to be a lot. And you made reference to what Seth Berkley, my CEO, said recently. It also means that we have a significant challenge of delivery itself, because if we were dealing with a past delivery process, it would be a little bit smoother. But now we are dealing with a condensed delivery period of higher volumes. And what that means is that we will see situations where we may have wastage of vaccines in other places, because countries simply do not have the capacity to handle them as well as they could if they were passed.
Some have criticized, Thabani, the criteria that Covax's vaccine allocation has been using, that has been based on the population size as opposed to where the need is the greatest. Is that a flaw in your methodology? Is it being discussed and looked at?
Look, I think that question is an interesting one. You can follow the disease, or you can get ahead of the disease. And it's a choice that we have got to make. The truth is, this disease thrives on populations. And so where you have a larger pocket of a population that still remains at risk, you still have a risk. So either way, it's a chicken and egg type of game. Chase the disease or get ahead of the disease. And the choice we've made here is one of recognizing that we will not be following the flares of the disease, but we have to actually put a hedge ahead of it if we can. Obviously, that is not entirely true at this particular point, because there is still a lag with what we have to try to stop that tide.
You know, we touched about on funding earlier. How does Covax's buying power compare to, say, a European Union or a United States? Help us understand the constraints you have faced and the tough conversations you are having behind the scenes with some of the pharmaceutical companies. We touched on this in our previous interviews, these backroom negotiations and talks. It's not a straight line, and there's no real silver bullet, is there?
Sure. It is very difficult to compare Covax buying power and that of the United States or Europe. Number one, Covax was built on the fly. The United States existed long before Covax, and it had systems and it had mechanisms that allowed it to mobilize much faster. We were setting up an institution that was supposed to respond to this situation and fundraising at the same time, and making negotiations at the same time. So there's been a lot of building on the fly that has been happening. That means that, the progress we have made is actually remarkable if you think of it. When you think that March last year, we were not even an institution that existed.
I asked this question because I've seen some reports where Covax is getting donations of Pfizer vaccines from the United States as opposed to buying them directly from Pfizer, and that's been a relationship fraught in terms of getting onto the same page. Are those reports accurate?
The United States, when it is donating, it is donating from some of its own vaccines that it would have procured. And if there was any other alternative there that would be slightly different, is that maybe the United States would give us an opportunity to take some of its shares from what Pfizer would have given. And that to us is a benefit, because instead of the United States keeping those for themselves, they are recognizing that there is a gap that needs to be responded to.
Last time you and I spoke in March, we talked about how the world is in this race against variants and mutations, probably more true today than it might have been back then. The United States President Biden talks about how this now is a pandemic of the unvaccinated in the United States. So while on the one hand we talk about inadequate vaccine supply, Thabani, or access, on the other you have vaccine hesitancy that together is driving the scenes we are seeing in ICU wards around the world. What can you say about the scenario I've just laid out?
That scenario is one that really breaks our heart, because here we are crying for an Africa that has been left behind. And on the other side, we have a world where people are being begged to actually get vaccines. And that's why it makes sense when their governments begin to donate to Africa. Vaccines are not going to waste. We think that this is a gain, because if they had to wait for their own populations to come to the table, in some situations, some of those vaccines would end up expiring in their hands. And we need them somewhere. So dose donation is the best thing that ever happened, because it recognizes that we have got to solve this on the vaccine hesitancy side for their world, or for the developed world, and for the developing world access at the same time.
I'm glad you touched on the ethical nature of this, because they're literally giving away $1 million lotteries in some states in the United States just to get people to get their first shot. It's a strange scenario to live through.
It is. It just doesn't make sense to be having such a situation right now.
In places where we have the highest vaccine penetration, we are already beginning to see the worlds of the vaccinated and the unvaccinated collide. Even anger beginning to emerge between the two groups as people continue to die and, of course, new mutations continue to emerge. GAVI has long talked about how vaccines will help reduce stigma associated with those who had become infected. But if we flip it, Thabani, how concerned should the unvaccinated be about the stigma that is fast emerging towards those refusing to get the shot or who haven't had access to the shot? The reality is that vaccinated people don't want to be close to unvaccinated people. Is that problematic?
Well, I think what is problematic is maybe let me take a step back. GAVI believes that vaccination is an individual choice that people have to make. So we still subscribe to the notion that people have got to make a choice. But we also, from a public health perspective, believe that if you cared enough about your family, about your community, you would consider vaccination as something that is worth doing for yourself. And so the argument here is that those who are unvaccinated, there may be reasons why they're in that space. And instead of actually making them the enemy, should we actually invest in understanding what is the barrier and how can we be helpful?
So is it not a contradiction in terms to argue that to get vaccinated is to reduce the chance of mutations? It's part of, the collective good strategy, and yet it is an individual choice and you can opt out if not. Is that not simply put a contradiction in terms?
I think it has an element of contradiction, but look here, when we talk about herd immunity, you will notice that countries never talk about 100% vaccinated. And we understand that there will be a portion of the population that may not be vaccinated. And in this particular situation, simply for reasons of access, for availability of vaccines and what have you. So if you were to compel everybody to be vaccinated and yet you can't provide vaccines to them, is that not contradictory as well? It partially is. So I think the argument is we would love as many people as is possible to be vaccinated and to use all the vaccines that are within our hands to vaccinate people, but also bearing pragmatically that we will never get 100% vaccination.
Final question for you. You've talked about the circular nature of this pandemic. What's the lifespan going to be of Covax here? I mean, you're talking about 30% of 138 participants being vaccinated by February 2022. We don't know what mutations we might be facing at that point. What's the trajectory for the work you are doing in terms of Covax?
Sure. I think you will know very well that before Covax, there was GAVI. And GAVI had been in the business of vaccines for 20 years. And so I think the first vision here is to continue to support the countries. For instance, Africa has a target of 60% that it is going towards, and we will support them as best as we can with that target. But even whether Covax as an institution exists or it doesn't exist, GAVI will still exist, and GAVI will still want to be to stand next to the countries in supporting them with their efforts. After all, getting through Covax gets us back to business, which is making sure that routine immunization is happening everywhere.
I mean, I guess my question was, put simply, this pandemic isn't going anywhere anytime soon.
Well, I wish I couldn't agree or I could be smarter there, but the truth is, at this rate, we still have a challenge ahead of us. And yes, we could be going up to 2024. Who knows?
Thabani Maphosa, the GAVI's Managing Director of Country Programmes, many thanks indeed, as always, for taking time to sharing your analysis and thoughts with us. We appreciate it.
Thank you, Sherwin. It's always good to be with you.